Since the beginning of the COVID-19, there have been conflicting ideas regarding prevention and control measures for the virus. Recently, some have pointed fingers at China's dynamic zero-COVID strategy, saying it is not sustainable, while the country says the policy is meant to maximize the protection of people's safety and health. For more on this, we're joined by Gideon Chitanga, who is a research associate from the African Center for Studies of the United States. Gideon, very good afternoon. Talk to us about your sentiments. Where do you stand regarding China's zero policy on COVID-19?
Thank you, and good afternoon to your audience. I think this is an important intervention, and I think it is important to state that this same model is the model that was universally applied across the globe as the main template to contain COVID in the beginning of COVID in early 2020. The center of it is basically imposing lockdowns. If you consider that government or the state has a responsibility to address COVID, you will understand that that is exactly what China is doing. Immediately intervene, contain COVID before it spreads quickly and efficiently, isolate cases. And in terms of the broader model, it's followed up by the general trend that we have experienced even here in South Africa in terms of disinfecting places, providing health care, minimizing human contact. And in the case of China, what is important is to understand its demographics. This is a highly populated country, 1.4 billion people. If you consider its demographics, it has a relatively higher elderly population and children. You also have to understand that its population density is very high compared to Western countries. So under those circumstances, safety measures are really key. And I think the zero COVID policy in the short to medium term, even long term, will actually prove to be the most efficient way of addressing the COVID outbreak, arresting it and ensuring that it's slowed down first and eventually dealt with on a more longer term basis.
So you're saying that there is a correlation between population density and the spread or impact of COVID-19. Now, how is COVID-19 related where you have townships and slums across the globe that are densely populated? Have we seen a corresponding rise in COVID-related illnesses and deaths in those areas?
So I would say that places that have a higher population density obviously do have higher chances of human contact, and where COVID is identified to be prevalent, then it tends to spread very quickly. So the basic intervention in those circumstances would be to quickly identify cases of COVID, trace the infected people, have them quarantined and provide medical services and facilities, while making sure that the places, the rest of the population are safe from contracting the disease and spreading the pandemic. So that is basically the model.
Now, Gideon,
and I think that the experience of the past 2 years shows that people who are relatively living in very concentrated conditions are more vulnerable than people who live in places with more space and contact is minimized. And this is the logic that actually informed lockdowns as the first mode of intervention globally. And I think it remains the most relevant in cases where COVID is intense. But it has its own social consequences, and I think the need to balance lockdowns with social interests and business interests is quite a delicate one, without really saying that abdicating from the responsibility to lay down key regulations that are protective first before responding to other interests.
Gideon, let's bring that closer to home. Let's talk about South Africa, informal settlements and the townships. Have we seen a marked number of COVID-related illnesses and deaths coming out of the townships and informal settlements relative to everywhere else.
I actually think that is the case, but the problem is the mechanisms that are applied, they do not necessarily respond to the conditions in the townships. So in most cases, when you get the statistics that are available, it is my hunch that these areas, which are generally marginalized and you have more poorer people living there, are not included in our scientific assessments of COVID, and generally a lot of policy issues that are of concern. And because of that, a lot of critical information that would be relevant in informing policy with respect to these communities is overlooked. And this is why these places are in most cases left behind or left unattended.
But surely as a research fellow, you can't rely on hunches. I think a lot of what we've been discussing this afternoon certainly is based on scientific evidence.
So I say that because I don't have information to that effect. I would not want to say that I don't have the information does not mean it's definitely not there. But I can debate these gaps with any policymakers, including the authorities that are involved in policy decision making with respect to COVID interventions in South Africa.
Okay, then let's come back to the issue of trends, and certainly that we do not, the opinions or the practices around COVID-19 2 years ago or so when it was first discovered to now are different in many respects. And one of those issues is the issue around herd immunity. What is your take on herd immunity? It certainly seems to have worked the magic in a number of countries.
It has worked magic in different countries. But I think that what is key is to consider that these different countries have different social contexts. For example, if we are in Africa, you obviously would look at South Africa being in a different position than other countries, socio-economically that is. But also within South Africa, you also have layers of different socio-economic groups. So generalizing and looking at the top layer of the population, it portrays a totally different picture when you go to the lower scale of our populations, because the dynamics are different. Access and relationship with policy interventions is different. And in general, the social sectors, which are mostly middle class and the more elite people, they tend to be part of the key information that we apply more than the lower class people, the poorer people. And that also relates to the world interpretation of the herd relevant statistics that we apply.